Hello everyone, happy Friday. I'm Rendi Murphree, epidemiologist and director of disease surveillance at the Mobile County Health Department. This is our daily update on the effect of COVID-19 pandemic on Mobile County residents. You know, today is the 15th, Friday the 15th of May. It was Friday the 13th of March when Alabama announced its first confirmed case of COVID-19 in an Alabama resident. So although it's only been 2 months since we have been dealing with this outbreak in Alabama and in Mobile, we have thousands of cases in Mobile County, 1,600, more than 10,000 in Alabama, 1.4 million in the U.S., and 4.4 million or greater internationally. So I just give that perspective to remind you that we are still very early in the course of the outbreak of COVID-19 in Mobile County, and we just want to make sure that despite some of the recent relaxation of the safer at home order, that you remember that COVID-19 and the virus that causes it is still a real and present threat to everyone in Mobile County. And since our entire population is naive to the virus, we are at great risk of this novel disease. Let me tell you a little bit more about some of our patient characteristics. I want to mention that we have a dozen cases reported among children aged 0 to 4. So we have very young children who are getting infected with COVID. Luckily, they are doing well, but it just speaks to the importance of reducing community transmission of COVID, because children are tag along with their families or play with their friends, or maybe are in daycare facilities that are open for essential workers, but it just again reminds me that there is a lot of community transmission going on out there, and people who are well and healthy and potentially spreading virus are sharing it with the youngest of our populations and also with our oldest or our most critical patients. So just keep in mind that no one is immune, that it can affect every age group, sex, race, and age. So please continue to protect yourself by wearing a mask when you go out, staying at home if you're sick, limiting the number of people that you're around, maintaining that 6-foot distance when you do have to go out, washing your hands, covering your cough, and again, staying at home if you're sick. So I just wanted to mention that it's pretty shocking when you first see the reports of people less than 4 years old, babies less than 4 years old getting COVID disease. So I won't go into much more detail about the cases today. You can have access to our report online. Not much has changed about the characteristics of those that have been hospitalized or those that have died. So let me instead talk about some additional information that we don't generally get around to talking about. So I am continually asked about the number of outbreaks that are going on in congregate settings. Right now we have we have 7 sites that have at least 5 cases. We have 7 sites that have 5 or less, and we have around 23 sites that have no reported cases. Again, we have an outbreak that we're monitoring closely that's been going on for some time in a detention center, but that one seems to be slowing. And then we have probably 10 or 15 other locations that we're keeping a close eye on, where more than 1 case has been reported in people who are not related to each other. So these are things like senior citizen housing complexes. We're starting, of course, to see clusters of cases in some businesses. And with the lifting of the safer at home order, with the lifting of some restrictions, we are going to see clusters of illness in areas where people are congregating and violating that 6-foot rule. And the number of clusters that we are able to report on is going to go up. And again, we generally do not report on the name of the facility unless there's a compelling public health reason to do so. But we will continue to give you some aggregate information. So just a statement about, when you ask us, hey, can you confirm that the restaurant in Satsuma is closed because an employee tested positive? We're a covered entity under federal law. Therefore, we have to adhere to the HIPAA privacy restrictions as well as all the applicable state laws, specifically Section 12-11A-2, Code of Alabama, 1975. We're not permitted to provide the requested information, but again, we know everyone's interested, and you guys know that came from our attorney, right? I don't know Alabama code, but thank you for our compliance officer and attorney for writing that statement for us. All right, some other questions. In addition to what we're doing in congregate settings, someone was asking what's the latest in the health department's role to fight the virus here. So we continue to assist in congregate settings who have cases by consulting with them about infection control, about containing the spread of the virus, about testing, recommendations of who they should test and how often. We try to help them with receiving personal protective equipment, anything that we can do to assist. We are doing that. As far as community spread, at this point, most of that is messaging and trying to remind people that the widespread community transmission is ongoing throughout the entire county and state and neighboring states, and that no one is safe from potential exposure unless you are at home. The other thing that we are doing is expanding testing. So we know that there are plenty of locations out there that have capacity for testing that is not being tapped. Our Family Health Division, the Primary Care Division of the Mobile County Health Department this week, made testing available at all of their locations, regardless of your ability to pay, and without restrictions on things like symptomatic or essential workers or that sort of thing. So if you feel like you need a COVID-19 test, you can get one at one of our health department sites with no charge to you. Call for an appointment ahead, 690-8889. But if you don't have an appointment and you show up, you may be able to call and get an appointment while you wait. All right. Several state departments are now investigating. We talked about this earlier this week, this pediatric multi-system inflammatory syndrome. And yes, the state has released a HAN, a health alert network, and I don't have it with me, on a call for cases. So the CDC and the Mobile County Health Department published a health alert network to let providers know to be on the lookout for particularly pediatric patients, but anyone who is showing symptoms of multi-system inflammatory syndrome in any patients, but particularly those that are positive with COVID disease. And the question was, are any of our younger cases, those that are less than 24 years old, do they have this syndrome? And I don't know the answer to that. Again, this is just being brought to the attention of our local providers and hospitals. So we will continue to keep a close eye on that, and I'll keep you informed. Mark's going to save me again by giving me the HAN. So again, today, the Alabama Department of Public Health issued an Alabama Emergency Response Technology Health Alert Network, multi-system inflammatory syndrome in children potentially associated with COVID-19. So there are some key points that states are reporting cases compatible, and again, that's at the discretion of their physician. At least 3 children in New York have died as of May 10th. It appears to be characterized by persistent fever, severe inflammation, evidence of poor function in a single organ or many organs, and other specific clinical criteria and laboratory features in the absence of other known infections. So again, there is a lot more information. They're looking at individuals less than 21 years old with fever for greater than 24 hours, laboratory evidence of inflammation, and evidence of severe hospitalization, illness, multi or single or multi-organ dysfunction. So we will continue to take a look at that. I'll go back. I'm almost positive that the children in Mobile County that have been reported as having COVID have tolerated the infection well, but we'll go back and take a look at our cases, and then going forward rely on our healthcare community, our provider community, to help identify this multi-system inflammatory syndrome in persons less than 21 years old. Okay, let's see. Someone asking, of the cases that we have since March, how many have recovered? Well, again, in my daily report that is available online, we're reporting that 20% have recovered, but I also want to mention that there's going to be a slight shift in the way we calculate that. Mobile County has been providing that statistic for some time now, and this is just based on our patient interview, that if they tell us they're no longer symptomatic, then we identify them as having recovered from illness. So for us, that's around 20%, but there's been a lot of discussion. CDC doesn't have a definition for what recovered means, and different states are using different definitions. So this Alabama Department of Public Health has decided to begin reporting on presumed recovered, and that definition will go into effect probably starting sometime next week. And then when we are able to, we will switch over and use the presumed recovered definition that is developed by the state health department. So more on that next week. For right now, it looks like it's around 20%. Okay. At what point or how many days after being exposed to someone with COVID will you become contagious? So a couple of things go into this. First is what we call the incubation period. So if you are exposed to COVID, if that virus gets into your body and if it starts to replicate inside your body, generally you will start showing symptoms between 2 and 14 days. Most people will start showing symptoms between 2 and 5, but 2 and 14 is what we call the incubation period. So that's the period that the virus is incubating in your body, and if you can fight it off, great, but if not, it will multiply and it could make you sick. In general, people who are symptomatic or a few days before being symptomatic can be contagious to others. That's normally what happens, but we know with COVID infections that for some reason, some people who are infected don't know it because they do not develop symptoms, but they can still be contagious to others. So it makes it very difficult to know, which is why CDC began recommending face coverings for everyone and really emphasizing the importance of social distancing, because we have contagious people out there who are infected with COVID and don't know it. And if they're out in the community without wearing a face cover, they are, spreading the virus or spreading their germs with other people, and they don't even realize it. And this is one of our biggest concerns about transmission, particularly to those that are most vulnerable to complications like hospitalization and death. See, can we please get a list of businesses not requesting customers to wear masks? It would be nice to know where not to go. So wouldn't that be nice if we had that information? But no, we don't maintain a list of people who are businesses that are requiring masks. Has there been any retesting of samples from back in the early part of the year to find out when cases started in Mobile? There have been reports of it starting back in February. If you look closely at some of the graphs that I think I maybe stopped showing that one, but yeah, we have a couple of patients that when we talked with them and found out that they were COVID positive, they reported symptoms going back to early March, and one person even back to very, very late February. She had some underlying conditions and had a persistent cough for a month or something like that. So it's a little bit hard to tease out, but no, we have not put forth a major effort to try to figure out, when was COVID-19 being, circulating first in Mobile, but we know from our first few patients that it was likely late February, early March. Okay, someone was asking about if there have been any updates on recommendations for the use of the drug hydroxychloroquine. The science has not changed on that it can potentially cause more harm than good, and until clinical trials support a benefit that outweighs risks, we will continue to leave hydroxychloroquine off the table and not recommend the use of that for patients. There is, however, some good news that came out on a medicine called remdesivir, and some clinical trials showed such good promise that hospitalized patients that were treated with a 5-day or 10-day course of remdesivir showed promise. And so the Department of Health and Human Services bought up a bunch of this drug and just shipped it to the states. So the state health department in Alabama received a shipment on Monday and another shipment today, and every hospital in Alabama has received at least one course of this drug, and hospitals that have COVID patients in ICU have received many courses of this drug so that they can use it to try to improve outcomes among people who were hospitalized. So that's a really good change in our potential treatment capacity for COVID patients. And again, that is remdesivir. It's going to take a little bit of time for me to get practice saying that. There are a couple other clinical trials of things going on, like you've probably heard convalescent plasma, that when people who've had COVID, donate blood and their plasma is separated, that you can inject that plasma into COVID patients and it will, reduce their complications or, improve their outcomes. And then there are other things happening with regard to existing antivirals, in addition to the work that's going on to develop new therapies. So stay tuned on that. So I mentioned about COVID being, not really caring about your age or your sex or your race. It's highly infectious and will infect anyone that it can come in contact with. But I wanted to share with you a recent article out of a CDC publication on just how infectious the virus can be in closed settings. So there was a CDC report out of Washington where a choir practice resulted in a large outbreak of cases, and in fact there were, I think, 53 people in this choir, and one person had symptoms of COVID. One person. And 52 people in the choir became infected with COVID. And that left only 8. Only 8 people avoided getting COVID during that 2.5-hour choir practice from one person who was infected. So 52 people got infected, 8 did not, from one case of COVID disease. And again, this emphasizes the difficulty of 6 feet of separation in a closed setting. And again, it's just shocking to me, and I just thought I would mention that.
That was this week's report, looking back to March.
Okay, so Mark is just reminding me that this CDC report just came out, but the event actually occurred a couple months earlier in March, and it was a choir practice, again, in Washington State, in Skagit County. That's available online, the whole report, if you want to go and read it. There's this really cool infographic that sort of helps you see how contagious the virus is. In a choir setting like that, where people are singing, they tend to expel more respiratory droplets, and so that made an infectious virus even more efficient in infecting people that were not not having that physical distance between them. All right, want to just go over a couple other things that might be of interest to you all here that I got in my inbox today. Let's see. Health and Human Services is working on releasing plans to restructure the Strategic National Stockpile, implementing the lessons learned from recent pandemics. So we know that the Strategic National Stockpile emptied very quickly during the COVID-19, and our government is working on improving by increasing supplies of the critically needed items, integrating predictive analytics to determine needs, leveraging technology to provide real-time visibility of supply chains, and reducing dependency on foreign suppliers. So I think that's really great that we're already beginning to implement the lessons learned from COVID pandemic as moving forward in things as important like the Strategic National Stockpile that keeps life-saving medical supplies on hand when our country needs them most. See. I found this interesting that the FDA is hosting a virtual town hall on May 15th, I guess that's today, for researchers, clinical laboratories, and commercial manufacturers to discuss the production and use of 3D printed swabs during the COVID-19 emergency. So this sounds really cool to use this 3D printing technology to print swabs that can be used for testing for COVID-19. That was just so cool and interesting to me. There have been some really helpful documents made available recently to help camps, schools, child care facilities, restaurants and bars, mass transit, and workplaces with employees at higher risk for severe COVID illness to decide when or whether to open. So for these different types of facilities, and there's a separate one for each type: schools, camps, and child care programs, restaurant, bars, and workplaces, and mass transit. And it sort of helps business owners step through a series of questions and get some guidance from CDC in whether or not it's time for you to open. Things like staff, disinfection, the availability of masks, the availability to distance, those sorts of things. But those that are on our Facebook page where you can access those and print them and walk through them if you are a business owner or a manager. Let's see. So the CDC has updated their information for groups at higher risk for severe illness. So based on current information and clinical expertise, older adults and people of any age who have serious underlying medical conditions might be at higher risk. So their website includes tips to reduce your risk. But again, older adults and people of any age who have serious underlying medical conditions. So just wanted to point that out, that it's not, it's older adults or any adult or any person who has a serious underlying medical condition. CDC has also, we're coming into preparing for hurricane season, and this is a real concern when you have potentially two natural disasters going on at the same time. The CDC has already begun thinking about this and has provided some interim guidance on mass sheltering during COVID-19 pandemic should it be needed during a natural disaster like a hurricane. So it's good that they are thinking about it. Our emergency preparedness team has already been talking to the Mobile Emergency Management Agency to start planning for how will we continue to protect ourselves from COVID transmission if we have a storm that requires evacuation and people staying at mass shelters. So it's really good to know that people are already thinking about that. So if you haven't already thought about preparing for hurricane season, now's a good time to go ahead and start refreshing your hurricane supplies and get those stocks refilled if you've been depleting them because you've been at home for COVID. So I'm going to stop there and wish you a safe and healthy weekend, and we'll talk to you again on Monday. Thank you.